Hi everyone, welcome back to my YouTube channel. Today we are going to talk about openings in cranial cavity. We will start the topic with introduction. Cranial cavity is not a sealed container. It's a vital passageway system. Its numerous foramina, fissures and canals allow cranial nerves, blood vessels and other structures to travel between the brain and rest of the body. Understanding their location and what they transmit is fundamental in anatomy, neurology and surgery. Openings in anterior cranial fossa we will first talk about, then we will talk about openings that are present in middle cranial fossa and then the posterior cranial fossa. Openings in anterior cranial fossa, this is the shallowest and most anterior compartment associated primarily with olfactory region of brain. It has cribriform plate that is ethmoid bone, the part of ethmoid bone. It is located on the cribriform plate. Cribriform foramina are located on the cribriform plate. They transmit the olfactory nerve fibers from the nasal mucosa to the olfactory bulb. Next opening is foramen cecum, that is between the frontal and ethmoid bone near the cresta galli. It is occasionally transmit a small emissory vein from the nasal cavity to the superior sagittal sinus. Next, we will talk about openings that are present in middle cranial fossa. This region houses the temporal lobe and contains many crucial cranial nerve and artery exist. First is optic canal that is present in sphenoid bone. It is located within the lesser wing of sphenoid bone. It transfers the optic nerve and ophthalmic artery to the orbit. Next opening is superior orbital fissure that is present between the greater and lesser wing of sphenoid bone. It transfers oculomotor nerve, trochlear nerve, ophthalmic division of trigeminal nerve and abducens nerve and superior ophthalmic vein. Next opening of middle cranial fossa is foramen rotundum that is present posterior to the superior orbital fissure. It conveys the maxillary nerve into the pterygopalatine fossa. Next is foramen ovale, that is larger oval opening that is present lateral to the foramen rotundum. Relate all of these foramen position with one another. It transmits mandibular nerve, accessory meningeal artery, and sometimes the lesser petrosal nerve. Next is foramen spinosum, that is present posterior lateral to the foramen ovale. Its entry for the middle meningeal artery, vein, and meningeal branches of V3, that is mandibular branch of trigeminal nerve. Next is foramen lacerum, that is irregular opening filled with cartilage in life. It is not a true conduit, but the internal carotid artery run over its superior surface. Next is carotid canal that is present in the temporal bone. All of other openings we have talked about are present in the sphenoid bone. Then we have a carotid canal that is present in the temporal bone. It opens just anterior medial to the jugular foramen. It transfers the internal carotid artery and accompanying sympathetic plexus into the cranial cavity. Now let's talk about openings that are present in posterior cranial fossa. This deepest compartment houses the brainstem and cerebellum and contain key passageway for lower cranial nerve and vascular structure. It includes internal acoustic meatus that is present in the petrous temporal bone. It allows entry of facial nerve and vestibulocochlear nerve. It leads to the facial canal and cochlea or vestibular organs. Next opening is jugular foramen that is present between the petrous temporal and occipital bone. It transmits the glossopharyngeal nerve, vagus nerve, and accessory nerve, and internal jugular vein is also passed through the jugular foramen. Next is hypoglossal canal that is anterior lateral to the foramen magna. It is passageway for hypoglossal nerve. Next is condylar canal that is variable, that means it is present in some people but not present in some people. It may transmit an emissory vein from the sigmoid sinus to the external vein. Next is foramen magnum, that is the grand central opening. It transmits the medulla oblongata, spinal roots of cranial nerve number 11, vertebral arteries, anterior and posterior spinal arteries, and surrounding meninges. Now let's talk about clinical significance of the cranial cavity or openings in cranial cavity more specifically. First is CSF leakage that may occur through fractures in cribriform plate, that is anterior fossa, and it is more susceptible to fracture because of its sieve-like appearance on many cribriform foramina. Second is epidural hematoma that are often due to tearing of the middle meningeal artery near the foramen spinosum. Third is tumor of pituitary gland that can affect structures near the optic canal and cavernous sinus. Fourth significance is posterior fossa lesion that can compress multiple cranial nerves and the brainstem. Now let's talk about conclusion of this lecture video. Cranial cavity openings are portals of precision, each with a defined function and destination. Together, they form the communication network that links your brain to your body, senses, movements, and vital operations. And this was all about the openings in cranial cavity. Hopefully, you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.